Good evening. We start tonight with the latest on the virus outbreak in China. Hundreds of British citizens waiting to be flown home from the worst affected region will be put in quarantine for 2 weeks on their return to the UK. Passengers will apparently be asked to sign a contract, agreeing to commit to what's called supported isolation, though the location of that is not yet known. British Airways has suspended all direct flights to and from mainland China because of the outbreak. The virus, first detected in the city of Wuhan, has caused more than 130 deaths so far, spreading from China and to at least 15 other countries. In a moment, we'll have more from our medical correspondent, Fergus Walsh. But first, this report from our China correspondent, John Sudworth.
Safely out of Wuhan, a plane arriving at a California airbase with 200 Americans on board. Earlier, Japan got a flight full of its citizens out, touching down in Tokyo.
The night before the Great Escape.
But the Brits are still only preparing to leave. Khan Lambert's grandmother, Vera, stuck here on holiday, is running low on her medications.
How do you feel about going home?
Delightful.
There's frustration with the UK government.
I think it's been an absolute shambles, to be honest with you. I don't think the government have really known what they've been doing. I don't think they've had as much contact with the Chinese authorities as they say, because if they had, I would assume that they had been getting the same information that the Americans had got, that the Japanese had got, and they'd have been able to put plans in place sooner.
Despite the lockdown, infections in Wuhan are still rising rapidly, and anyone flown home from here faces 2 weeks in UK quarantine. Maeve Clark, a lecturer from Birmingham stuck in Wuhan, says she understands why.
I think it's a good precautionary measure. It's in line with what other governments are doing as well, and I think it gives reassurance to people back home, back in the UK, that the right steps are being taken.
Much is still not known about the virus, but across China, few are taking any chances. Villagers are putting up roadblocks and shutting out the world with great barriers of earth. No outsiders are allowed in at all, this man tells me. Beyond the human cost for China, there's another impact to all of this: fear, with countries beginning to advise against travel, with airlines cancelling flights, and with whole villages cutting themselves off from the outside world. The economic cost is likely to be severe.
My name is Nick.
For some UK nationals, escape is not an option. Nick House is British, but his wife's from Indonesia. She's been told she can't get a place on the plane.
My mum and dad are worried, my sister's worried. They just want us home, really.
They face more long weeks of uncertainty in a ghost city. Well, Huw, this appears to be a hugely complex and fluid situation. The UK government has just said that the flight will not now take off on Thursday as planned because the necessary Chinese permissions have not been given. We also understand that it is China's own rules that prevent non-British citizens from boarding that flight, and the UK government says it is working to keep families together. Clearly some difficult negotiations going on behind the scenes. Wuhan was once one of the most dynamic and connected cities on the planet. This virus has made it one of the hardest places to leave.
John, many thanks again. John Sudworth there with the latest for us in Beijing. Well, earlier this evening, the Health Secretary, Matt Hancock, chaired a meeting of COBRA, that's the government's emergency committee, to discuss the British response to the outbreak of coronavirus. The World Health Organization says the whole world needs to take action to stop the spread of the new virus. Our medical correspondent, Fergus Walsh, has the latest.
This was the last British Airways flight from mainland China, arriving at Heathrow this afternoon from Shanghai. Another flew in from Beijing. It follows the Foreign Office advising against all but essential travel there. The suspension of BA flights to and from mainland China is until Friday, but may be extended.
My worry was, I thought, well, if I get it and I go into hospital, I'd rather go into hospital over here than over there. I mean, you'd just be a number, wouldn't you?
The Health Secretary, Matt Hancock, said anyone returning from Wuhan on a repatriation flight would be safely isolated for 14 days. But where? Health officials suggested a military base, but the Ministry of Defence wouldn't confirm this, and Britons waiting in China say they've not been told. So is quarantine sensible?
I think that this is a pretty balanced response, actually, given the circumstances. On the one hand, you have individuals who are marooned in China at the moment, and there's a responsibility to British subjects to look after their interests. Against that of protecting the British public and making sure that we don't bring back people and actually cause an outbreak of this coronavirus in the UK.
The new virus, which emerged in China, is a variety of coronavirus. They take their name from these surface proteins, which look like the tips of a crown. Now, a lot of common colds are caused by coronaviruses, but in the past 20 years, 3 dangerous new strains have jumped from animals to humans. The Sars virus emerged in 2002 in China and killed nearly 800 people worldwide, about 1 in 10 of those infected. MERS originated in Saudi Arabia in 2012. It's since killed around 850 people, 1 in 3 of those infected. The new China coronavirus seems to be far less dangerous. It's unclear what the death rate is because thousands of infected patients are still in hospital, but it does seem much less lethal than SARS and MERS. Now, it's worth pointing out that seasonal influenza, flu, causes up to 650,000 deaths globally each year. As with flu, there's mounting evidence that the China coronavirus is contagious before people develop symptoms. It's passed through the air in coughs or by people touching droplets on surfaces. The virus infects the lungs, causing a fever, cough, and in some cases breathing difficulties and pneumonia. The incubation period is generally 3 to 7 days, but maybe up to 14 days. The next 2 weeks will be crucial in seeing whether this outbreak peaks in Wuhan and how much it spreads in and beyond China. Fergus, Walsh, BBC News.